Hi.
Well, welcome back.
Yeah.
Glad to have you with us and glad to have you with us. It's Thursday, it's 1 o'clock, and that's time for Opposite Saxes. Um, Subject today is
Pain.
pain, threshold
Pain.
for pain. And part of the reason for it is you are recovering from a knee replacement. And it was I guess to a certain point, it was an elective surgery. The
The
doctor
timing was
said,
elective.
yes,
It has to be
yeah,
done, but I could do it whenever I wanted to because
and
the pain
you
wasn't so horrible.
right, and you decided that rather than waiting until the issue became excruciating, the doctor said you can wait until you really can't walk
Mhm.
anymore, or you can do it now, but it has to be done. So you chose to do it. Um, always, when you have any kind of a surgery, major, or even not so major, if there is going to be pain after the surgery, it's done with medications. And you and I both, maybe our opinions differ a little bit with the medications and all, but we live in a time where take a pill or for anything.
That's my firm belief. Why should you suffer when a little pill can help you? And I have said this so often
And
in our marriage.
and I
And
have
you
re
like, I don't really need
I've
it.
rejected it most of the time.
Oh, yes, you have. Or you'll take a Tylenol. And
That's my go-to
I,
that's my go-to drug, and I will go to Tylenol for major surgery. I mean,
I can't understand it. I think it's fabulous. I, if I could do it, I would, but I need those drugs. But the problem with the drugs is that they have other side
the
effects.
side effects.
Yeah.
And that is a major issue
Yeah. It
now.
can be a real major issue.
You and I have said on this show, and we have said in open conversation, and those of you that are watching and following our show, you all sit and watch your television shows at night, and every other commercial break has got an ad for some kind of medication, whether it's for a topical cream or whatever, or it is something to help with the pain or help with and they talk about how much your life will be so much better when you take this medication. And then that ad goes on to talk about all of the downside or you know,
The side effects.
side effects, can cause nausea, headache, vomiting, all. And watching this commercial, I say, well, why would anybody in their right mind want to take that medication? Yeah, and the first
Because
thing is that the first thing they say is, don't take this medication if you're allergic to it. Huh? Hello? How do you know until you take that medication? And we talked about this
yeah,
ahead of
we talked
going on
about
the
this.
air too. And men have a tendency to have a higher tolerance for pain than women.
Mhm.
Women's tolerance is lower for pain. Why? Huh? Maybe childbirth. That childbirth for women is something that is on a much higher plane than most
What's
anything a man can go through.
describe? Although there are some of women that the babies just slide out.
Well,
Me, not so lucky. So
no,
I needed
well,
drugs.
we all watch the movies.
Yeah.
And when they show a
Scream,
woman in childbirth, she is yelling and
scream.
screaming, and she is going to reach out and take that doctor's larynx and just rip it out of his. If you don't give me something for this pain, get this thing out of my body. The only thing that I and most men can compare to it is kidney stones.
Yeah, I remember
And
that.
I have gone through that twice.
Yeah.
And I will tell you that it is the most excruciating pain. And when the first time we went to the hospital in the middle of the night, and I threatened the emergency room nurse to give me something for the pain, and she said we need a urine sample first. I said I'll pee on the floor and you can scoop it up if you want. I said, but I
But you don't get the first part of it, isn't that they're not going to give you pain medication
until I figure
until
out
they
what it
figure out
is.
what the problem is.
And I'm
So
sitting
there's
there
a
saying,
delay,
I have got a pain in my back, in my kidney area,
but it could be anything.
and the doctor's been following a kidney stone, and now it's moving. But still, I do remember very vividly that when they finally gave me something for the pain, oh God, this feels so good. Until the next morning, when I
Okay.
woke up on the surface of Mars, and I could not believe what it was doing to my head.
Right.
It was
It
my
happens.
kidney that was killing me. My urinary tract was killing me. Everything. But right now, my head was like a big bass drum,
Hmm.
and somebody was
It
beating
happens.
on it constantly. And to this day, whenever I have had a procedure, uh, and they give you a prescription for the pain, I am so leery, and you know that. And my rule of thumb is whatever you prescription you give me for the pain, I may start with a half a tablet to see what happens because
That's
I
okay.
I know that I have had some of those medications and taken a full tablet, and it's like beyond a high.
Yeah. No,
It
it can make you physically ill.
oh my
So
goodness.
that's why I would say start with half, and then you can always take the other half. But the problem is a lot of times they give it to you on an empty stomach in the hospital, and that's a big no-no. I don't know why they do that. Saltine crackers is just not going to work with a pill like that, a pain
You
pill.
mean for the side effects?
Yeah.
Yeah.
So, but there are other pills that you can try to for that pain that will not be will not have as many side effects. You just had a bad reaction, and at that point you said, "I'm off of all pain meds," and you never wanted to really give it
Do you
too
think
many
that
other
it's,
ones.
though it's kind of a rule of thumb that if you go through major surgery, which we have both had, and the doctor prescribes a pain medication, it is usually something that has a controlled substance in it, like a something like a codeine that's
Mhm.
in the and that's the reason that they prescribe it is because it's something that will react quickly for the pain. But yet every patient is different. You just don't know
You don't
how
know.
you're going
You don't
to
know. So
react.
that's why a lot of times they keep you in the hospital a little longer because they want to see how you'll react. Because if you don't react with that medication, now they got to try another one. And if the insurance companies will let them keep you, that's what they want to do. They want to check it out.
In other words, they're not as concerned about the surgery that you've gone through
No,
and the
he's
incision that
concerned.
they've made, and all,
Are.
it's just that you are just having difficulty with not only the pain, but sometimes coming out of the anesthesia will do the same thing.
Yeah,
That the anesthesia was such that made you loopy, and I've
absolutely.
been there with that too.
Absolutely
That
it
I
will.
am absolutely nauseous, not from the pain or the pain medication, but from the anesthesia. And again,
I
how
still
do the
think the
doctors
men,
or the anesthesiologists and the hospital staff, they don't know the ins and outs of each individual patient. They have to go by a normal
they have to
protocol.
go by the majority of the patients. They also go by your weight
Oh, that's
and
true.
the severity of what you're having done, of what the operation is.
Yeah.
Um, but would definitely agree with all these polls that they've taken between men and women, and I would say that the men have a higher threshold for pain than the women. Um,
And
now there, but now I just had a friend that had a knee replacement a few weeks ago, and she didn't touch one of those drugs, and she just had Tylenol. I said, "You got to be kidding me!"
see,
And she did it.
and I
She
would
did it.
probably be that.
Yeah, you would.
I would
You
at
would.
least get on a regimen of Tylenol or something until I realized that I do need more than this. And then the doctor will usually say, "Well, what are you taking?" Well, I've been taking extra strength Tylenol or 500 milligrams.
Yeah.
And he would say, "Well, up it to 1,000 milligrams, or you need more than the Tylenol, so I'm going to give you a prescription for Tylenol that's got a little something
A little bit
extra
of codeine in it.
in it." And I mean, I would always rather go that route
Hmm.
than to, and you're more familiar with the drugs than I am. There was a drug that I was given after a surgery that just completely looped me out. I don't remember what it was.
You haven't had that many surgeries,
No, I haven't had that many surgeries,
unless it was
but
something when you broke your ankle.
well, broke my ankle or when I had the prostate issues. Uh,
I don't know what they would have given you for that that would have made you
well,
that way.
I
I
don't
don't think
remember
so.
the name. Is it tramadol?
Well, tramadol is a pain
Is a pain
medication.
medication,
Yes.
and I do remember getting a prescription for that. I did one pill, and I may have followed up with a half a pill the next day, but the rest of the tablets went right down the toilet.
Don't say that in front of my mother.
Well, your mom,
Could take two.
oh,
And she had no problems
but
getting herself ready in her jewelry and her clothes and
but
hitting the dining room at
but
the retirement home.
yeah, except the people at the retirement home used to trade
Yes, they did,
medications.
and they were all used to
They
it.
meet me in the hall. I'll give you a
Right,
couple of my
because I'm
tramadol.
mine. But you, it's funny, you just couldn't take that. But see, that's just the way different folks are. I mean, if you take it for long enough, then your body becomes a little resistant to it. So you have to take more.
Well, that's what pain
That's
management is all about.
what.
Is that people get on something that does make them feel good, and all, but it get to the point where you become addicted to it, to the point where it doesn't do as much good. And we had
Or
a very, very good friend who's,
mhm,
unfortunately, his life was controlled by his pain medication, and he just couldn't get enough of it until it
mhm,
overcame him.
mhm.
Uh,
It
and
happens
and that happens, and it happens too
too
often,
frequently. Yeah.
But again, we talk about this a lot on our show, is you have to be knowledgeable. You have to do your diligence. You have to talk to your doctor and, okay, doc, what are you gonna prescribe after surgery for me? Oh, I haven't done that well with that. Now the doctor just says, this is what I prescribe. Well, if you haven't done well with that prescription, then you say, is there an alternative, doc? Is there something else that I can take? Well, yeah, I'll give you the extra strength
You
Tylenol.
ask a lot of questions before surgery, and that's one of them. So you know what you're going to get and how much of it you're going to get, because normally they will put you on it when you come out of surgery and you're half asleep.
Right,
So you
yeah,
can't ask then.
yeah, or you're on a drip, and
So yeah,
we
but you do. You have to be your own advocate, or you have to have somebody in your corner to be there.
we have always said to be proactive rather than reactive, and I
Mhm.
firmly believe in that, because I would rather know upfront in advance rather than having to play catch up, and be in pain, but the medication just completely undid what I was hoping it would do.
And you got to know how hospitals work and how doctors work. And because you asked me a question, I told you to ask the doctor if I was out of it. about giving me only a partial pill instead of whole pill in the beginning.
Or
And you questioned me and you said, well, what do you have to ask the doctor that for? Just tell the nurse you don't want the whole thing. That's not what the nurses go by. They go by what the doctors prescribe. And
and
if
you are
you
more
ask for
knowledgeable of
something
it.
else, if you
Yeah.
ask for something other than what they say,
Mm.
now they have to put in a call to the doctor. Maybe they can't get the doctor, or they don't want to call the doctor because they're too busy.
Well, but that's why
So you have to
you do
know.
this in advance, and you will ask the doctor before the surgery,
Right,
what are you going to prescribe for the
right.
pain after the surgery? And if the doctor says, I usually go with this, and you say, okay, in what dosage? And if he says 20 milligrams, well, doc, is it possible that I could do give me a prescription for 10 milligrams? And if I need to take two, fine. But
The problem
start with
is
10.
before surgery, sometimes they don't know because when they get into surgery, is sometimes where they can find extra things that have to be done to you
Hmm.
that they didn't plan on doing. Well, so that requires either a different medication or more of what they were going to give you. So you really can't ask that question about the dosages until you've gone through the surgery.
And my thought process is, I don't want to have to come back next week
No,
because
that's
I've got
right.
to undo what has been
No,
been
the
done.
only
Or
thing is, it's just that you suffer a little bit if it's too much of a medication that doesn't agree with you. Or when they give you that pill, and if you're up and not sleeping, that's when you start asking. Or that's when you have your advocate that's sitting next to you that
yeah,
will ask.
and my advocate is sitting right next to me because
Who's going to be my advocate for the next knee replacement?
But, well, but you know more. Sometimes you sometimes, and
Sometimes it
this
just
is
depends.
true. Sometimes she goes into a procedure knowing as much, if not maybe a little more than the doctor, because
No.
she has researched it and she knows that, doc, you're going to do this, but if I have this side effect, what are we going to do about it? And you ask those questions in advance. Me, do the procedure, and when,
Sometimes you're better off not knowing.
well,
I,
that's,
I will tell you that.
but not you, not you.
Yeah, well, I kind of like to know what I'm getting into. But again,
Yeah.
they can't answer the question all the time until they see what they're getting into.
And that's why this show is called Opposite Saxes, because we both attack and react to things
Yes.
differently
Well, anyway,
sometimes.
it's done, it's over. But yes,
Yeah.
men, I think, are a little bit easier when it comes to medications than
Yeah.
women.
And with women, the answer is often just give me a pill.
Yeah,
Give me a
yeah,
pill.
yeah. So I can get on with my life.
Make it go away. So, so go take a pill and come back and see us again next Thursday. Okay.
Bye, everybody. See ya.